Abdu, let's talk about briefly the what you're seeing, what we're being told, and what you're seeing on the front line. Let's see if that jives with what we're being told. We're being told that the folks that are most vulnerable to this particular type of virus are those that are 60 or 70 and older, as opposed to many viruses that we see attack the young as well as the old. This more seems to be directed toward the old and toward those who are immunocompromised, those who have longstanding cardiovascular disease, lung disease, pulmonary disease, kidney disease, diabetes, immunosuppression through either chemotherapy or their own bone marrow not functioning correctly, and smokers. Is that urban legend, or is that in fact what you're seeing on the front line?
No, that's absolutely true. But that's not to say that other people are completely immune to it.
Right.
And I think that's important. We've seen now some isolated cases of people who are younger who don't have any serious past medical history. I have a 30-year-old who's in the hospital right now. He's not direly ill, but he was unwell enough to require hospitalization. We also had an infant that died recently as well from this here in Canada. So, this is important to recognize. But you're right. If we contrast this to SARS, for example, SARS was much more unpredictable. SARS could just as easily attack a 45-year-old who was entirely healthy as an 89-year-old with end-stage emphysema. So by and large, most people will not be terribly affected by this. They will recover from it fairly uneventfully. But the key is also to remember, even if they do, they can transmit it to somebody else who may not be quite as fortunate. And that's the key.
Right.
We want to reduce the amount of exposure, break the chain of transmission to those more vulnerable members of our society who are not going to do as well if they get exposed.
And I understand this is a fluid situation, but what has been stated is that so far as people presenting symptoms most likely that folks are presenting with are fever, shortness of breath, coughing, a dry cough, some sputum related, very occasionally a sore throat, and the like. It's been said, Abdu, and I want to know if this is in fact your findings as well. About 80% of folks that are presenting with this are at an early stage with a type of cold symptoms, 15% in a moderate stage, most consistent with flu-like symptoms, and 5% that present more in a critical stage. Most of those people, not all, most of those people being in the elderly population or the immunocompromised. Does that correspond to what you're seeing?
Yeah, I think that's a reasonable breakdown.
And Deborah Birx, who again I believe is an outstanding scientist who is at many of these press conferences kind of leading the corona charge, if you will, on the president's task force, has stated that when she has looked and analyzed at the South Korean data, that of all the people that have those symptoms, so many people, Abdu, as you know, get these symptoms and go, I got coronavirus. Okay, of all those people that are symptomatic, that feel as though they have it, when they went in through the South Korean medical system, roughly 3 to 4% of those folks that actually came in actually were diagnosed as having coronavirus, that had those very same symptoms. The vast majority had some influenza type of entity or another type of infectious disease, non-coronavirus. Is that sound what you're finding as well?
I don't know the specific data around what you're referring to, so I don't want to comment on it out of place. However, what I would caution against is over interpreting that, because the problem is now we've reached a level of community transmission that is probably not entirely known, and therefore you have to be a little bit more vigilant about recognizing if the symptom complex is presenting, number one, who is it in? Is it someone who's at risk for getting much sicker if the symptoms are ignored? Number two, is there some degree of linkage whatsoever with either someone who was exposed, a known contact, or someone who had traveled to an endemic area? That needs to be explored, and the advice that I've been giving people is contact someone you can trust from a public health unit who can give you some information and some guidance around that, so you can determine if it makes sense that you should get tested, rather than just flocking to an emergency room or an urgent care clinic out of a sense of anxiety. That's probably not going to be the right way to approach it.
Dude, I want to speak about, as we conclude our interview here, about things people can do. My problem here is when we watch the media, not you, I'm talking about, the media here in the United States, it's always, before anybody can do anything, you got to wait for the new antiviral to come out. You got to wait for the new vaccine to come out. Stop. There are things people can do right now to decrease the viral load that they're experiencing, the potential of them getting this, and I'd like you to address that, because the message that's being delivered is, well, you can stay in your house and that's about all you can do. You know, Abdu, I do a series on people nutrifying, nutrients, minerals, this kind of thing, as far as the more upgraded your immune system is, the more protected you are, not just a coronavirus, but the whole shooting match across the board. Because my bag has always been prevention. What's your take on this? What can people do? Because I got in a lot of heat 9 weeks ago recommending people wash their hands frequently. I was trivializing the situation. Ugh.
Yeah, I mean, you make an excellent point. The reality is we're not powerless here. And to sit here and say, yeah, we've got things that are in trial phases, or this is not the approach that's going to win this battle. Vaccines are in development, but we're probably a year to 2 years away from that. We can't sit on our hands waiting for that to save us. There are antivirals, and there's a whole bunch of experimental therapies that are going through trials right now. But again, we're well beyond the stage of waiting for those things to rescue us. The reason that this virus has spread so rampantly across the world is there's been lapses in infection control protocol from one person to the next. These are practices we can make and routinize in our own homes, with our own children, with our own parents, with our friends, with our neighbors, with our colleagues at work. It's not beating a dead horse to say, look, washing your hands and doing it properly and doing it regularly will prevent 95% of viral transmission, whether it's coronavirus, the common cold, or anything else. We forget that. We forget that touching our nose, touching our eyes, touching our mouths is a really effective way to bring viruses into our body, including the coronavirus. We forget that wearing an N95 mask is not the right thing to do unless you're actually caring for someone who is actively sick with this, or you are sick yourself and are trying to prevent someone else from becoming infected. These are simple measures we can take within our own home that can empower us to prevent this from getting worse and to have it not spread through our communities. Don't wait for someone else. Don't wait for the government to rescue you. Don't wait for big pharma to rescue you, or scientists to develop a vaccine. Do it yourself. We can do it. We will do it, but everyone has to buy in.
So to those folks out there that say, I've noticed I got a runny nose. I noticed I got a little sore throat. I noticed that, well, I don't really have a fever, but I feel a little warm. Educate our listeners on what they need to do, because the last thing we want to do is overwhelm the health system, because then the people that really need it can't get to it, because we got a lot of folks that don't have the virus that are worried they do and can get in maybe a little quicker than somebody who's a little more ill.
Absolutely. I mean, that's a problem right here in Canada and in many parts of the world. The first thing that I would ask people to do is just take a deep breath and relax. Okay? Remember that more often than not, unless your immune system is heavily compromised or you're of a very advanced age, whatever you're experiencing in terms of nasal congestion, a sore throat, etc., is unlikely to be the coronavirus. What you want to do is, number one, stay at home. You want to wash your hands very regularly. You want to rest. You want to drink fluids and take Tylenol if you need to. We can all do this. And monitor yourself. By all means, if you get much sicker one day after the next and you're deteriorating, nobody is saying you should avoid being seen by a medical professional at all costs. But you want to give yourself time to get through it using basic common sense measures at home. Where you have to worry is if you fit into one of those high-risk categories. You're older, your immune system is compromised, and your symptoms are more than mild. If you're having trouble with shortness of breath, if your cough is progressing, if you're getting dizzy, if your level of consciousness is changing, that's when you need help, and you got to get it fairly soon. Give someone a call, and try and get to an urgent care center or a hospital without too much delay. But again, that's going to be the minority of cases.
One last issue, fever. I got a call the other day, and the person said, "Dave, I think I might have this." Why is that? I have a fever. Okay, well, what's your temperature? 99. No. That's not considered a fever. So, Abdu, when you say someone presents with a fever, what does an infectious disease specialist consider a fever?
Well, here in Canada, we use the Celsius scale, so I'll have to make sure I can convert it properly. But we use around 38.2 or 38.3, which I think equates to around 101.5, if I'm not mistaken, somewhere around there. So certainly under 100, I don't get too fussed or worried. We call that a low-grade temperature. So again, there's always variations, and some people don't mount the same febrile response if their immune system is not entirely normal or they're elderly. But in general, I don't get too alarmed with a temperature that's that low. And it's also important to note, what are the other symptoms? There's lots of viruses that'll just present with a febrile illness and not much else, and it'll run its course. So I wouldn't get too alarmed and too worried about things if it's a fever and nothing else.
And one last, many people say, well, the coronavirus is the same, is the same virulence, the same severity, if you will, as the coronavirus with the standard flu. And in fact, the data really doesn't indicate that, does it? It actually shows that the coronavirus, if you look at these case fatality rates, and particularly in the elderly, across the United States, the case fatality rate for the flu is 0.1%. If you look at the case fatality rate of those over 65, I believe the case fatality rate is 0.8. If you look at the case fatality rate of all comers, if you will, the South Korean data, it's 0.8 to 0.9. But when you look at the older age group, it's significantly higher than that. Even in Korea, it's when I look at the data, it's 4.3% in between 70. So in my world, and tell me, Dave, the orthopedic surgeon, maybe maybe my infectious disease professors would come down on me. But when I look at this, it does appear to be a more severe type of infectious disease. On the other hand, if you do the certain things as you've outlined, the odds are, if you do get it, big if, 80% of folks, unless they're immunocompromised or very old, are going to have a course that is what they've gone through before with a cold or with the flu. Am I wrong on that?
No, you're absolutely 100% correct. But the take-home message is that you're not just thinking about yourself. And it's the same thing for the flu. It's the same analogy for the flu. And I get this all the time from people who tell me, I'm 35 and I don't take any medication. Why do I need to get the flu vaccine? Why do I need to worry about this at all? It's not just for you. It's about protecting everyone around you. Because if you get a mild case of the flu and you're shedding virus next to somebody who's on dialysis or who's on chemotherapy or has emphysema or some other condition, and you're passing it on to them unknowingly, they could potentially get extremely sick and they could die from it. And that's the key variable we don't want to lose sight of here. We all need to protect each other. So yes, don't freak out and get too overwhelmed about it harming you, but be vigilant about the fact that you don't want to unnecessarily expose yourself and thereafter expose somebody else who may not be as privileged as you are with the best of health and immune competence.
And hence these restrictions on where folks should go at this point and the like. Abdu, you've been very generous with your time. I'd like to thank you for everything you have done, are doing, and will do. Abdu, how can folk? I'm sure you're going to write much more. I know you're a celebrity on the Canadian TV circuit. Don't take this. You're kind of like the Dr. Oz of Canada. I mean that in a good way. I mean that in a great way. You are educating the masses in a very articulate manner, and in a manner manner that doesn't make people fearful or panic, and that's a very excellent gift to have. How can I'm sure you're going to be writing more, because now that you're you get millions of hits on the stuff you do. How can folks follow what you write, because they need to?
Sure, they can certainly follow me on Facebook. Most of my posts are public now on Facebook if they have any relevance to health matters. So you can reach me there. You can also find me on Twitter. My handle is @Sharkawy MD, which is shark like the fish, and then AWY MD. Feel free to drop me a line, ask me questions, and I'm happy to respond as soon as I can. Everybody, wash your hands, be safe, and be healthy.
Abdu, I'd like to thank you again for being so generous with your time, and thank you for helping, if you will, bring some clarity and some semblance to the sea of chaos we tend to be in. My dad used to say repetitively, panic is easy, but a measured, rational response is what's really difficult. And I'd like to thank you for providing a measured, rational response to what we're encountering.
My absolute pleasure. Thank you, Dave.
Folks, until next time, this is Dave Janda signing off. And as we close every segment, dream big and dare to fail. Thanks for your time today.